Hello friends, welcome back, and this will be my last video on acute prescribing. I have only 2 or 3 more remedies to narrate based on continuing on the GIT remedies that we did last time. So the remedies are, first is aloes, then podophyllum and cocculus. First remedy, aloes. Aloes, we all know the popular symptom is involuntary stools, involuntary passing of stools or gas, but mainly involuntary stools with causative factors very similar to nux vomica. This is not very popularly known. In aloes, you have causative factors that are very similar to nux vomica. It is also a remedy like nux vomica which can be used after bad effects of taking excessive modern medicines or too much of medication, too much of outside food, sedentary lifestyle. When you see such kind of causative factors similar to nux vomica leading to complaints which are especially located in the rectum or the anus, that is where the difference is. In nux vomica, it seems to be the large intestine that is affected if we talk about the GIT, which is causing irregular peristalsis, and because of the irregular peristalsis in nux vomica, there is irregular or infrequent or ineffectual stools. In aloes, it is not the irregularity, but it is the circulation of blood in the rectum or anus region that is very important. So it has venous congestion of blood vessels in the anus or rectal region. Therefore, you see it is a very important remedy for piles, bluish piles, protruding piles, prolapse of rectum. This is where aloes is more indicated. So what actually happens because of this congestion or because of this excessive blood accumulation, there is always this sense of fullness in the rectal region. So patient does not recognize whether it is stool or whether it is the fullness that he already feels. So out of that unawareness, the stool seems to pass out. Involuntary passage of stools. I have observed many patients. I have tried to give just based on this symptom that patient has involuntary stools, and it has not really worked. I think what really works is this feeling of fullness, or when you see venous congestion in that area along with this involuntary stools, that is what is aloes. Another important symptom in aloes is rectal symptoms alternate with headache. Patient has headache is gone, rectal symptom comes. That is how aloes is. One patient I remember is a case of a 10-12-year-old boy who had come to me because his mother complained that today he was at school and suddenly he said, I want to pass stool, I want to pass urine, and by the time the teacher could take him, he passed urine and stools involuntarily. So the mother called me what to do. So I said, give him aloes. So temporarily patient was better, but this kept repeating. It happened once, twice, Patient is again having. So I said, no, something is wrong. Means this should go, not completely go, but it's not going. And this patient generally used to come to me because he had chronic cold. And the peculiarity was he had what? Crusts of mucus that would form inside the nose, and he in the morning every day he used to remove those crusts, and he used to always complain of nose block. So suddenly another day his mother called me, and she said yesterday night he was not sleeping the whole night, and he was constantly complaining of itching in the rectum or in the anus, and he could not sleep. The whole night he was sleepless. He said, because of this itching I am not able to sleep. So I opened Fatak repertory and I saw sleeplessness from itching in anus, and there was only one remedy there, that was teucrium. So then I understood teucrium is a remedy for worms, and because of worms the patient is having itching in the anus, and due to worms generally it is common for children to pass stools and urine involuntarily. And what was interesting is, if you read Fatak's Materia Medica, the first line of teucrium, if you read from Fatak, he says it is an important remedy for nasal and rectal symptoms, which is exactly what this child was having. And nasal symptoms with crust and nose block, teucrium is a very important remedy for nose block, polyps in the nose, etc. So I gave him teucrium and he improved drastically. So why I tell you this case? After teucrium he never passed that involuntary stool, or he completely recovered. Why I tell you this case is, sometimes what is happening is we are getting lost by seeing one symptom and thinking that one symptom is the peculiar symptom. I think before deciding that one peculiar symptom, we have to first understand the case as a whole and where each symptom is fitting. His whole symptomatology seems to be very well understood when we understand that the child was having worm infestation. Worms children, one is we can directly relate worm infection with rectal complaints, itching in rectum. But another part that we all should know is, because of worms there is always constant eosinophilia. Eosinophilia always tends to result in some kind of allergic colds, coughs that we have for a long time, chronically, which is the second complaint the child is having. So if I would have understood on day one that this is a case of worms and all the symptoms are only part of the worms, I think I would have reached teucrium maybe earlier. So every case we have to understand the overall synopsis, what each symptom is talking, what each symptom is a part of. Not just taking one isolated symptom and then feeling, this is the peculiar symptom. That is not what is going to give us lasting results. We may find patients feeling better slightly here and there, and only that symptom may reduce for temporary period. But that patient will keep coming back to you, keep complaining, it is slightly better, 20% better, 30% better. But that is not homeopathy. I have seen, when you understand the case, everything disappears. Disappears means disappears. There is no if, no but. ठीक ही होता है patient, cure, खत्म. मतलब this is true for cold, cough, coryza, tuberculosis, cancer, everything. So ultimately what Hahnemann told us, that you have to treat the totality of symptoms, and based on that totality you have to understand the clinical side of it. Then you have to understand the characteristic side of it, the peculiar symptoms. Once you have understood the clinical part of it. In this case, in the worms case, the clinical part was to understand that this is all symptoms are because of worms. That should happen. So, moving on to the next remedy. Next remedy that we will study is podophyllum. Podophyllum again is a loose motions remedy where you have profuse stools, prolapse of rectum, prostration, weakness, polychromatic, that is changing color constantly. So very popularly we say podophyllum has 5 P's: profuse, polychromatic, putrid, painless, and profuse, polychromatic, putrid, painless, and prolapse of rectum. But I have not seen all P's in my practice. What I have seen when I have prescribed podophyllum is when you see loose motions, which are profuse, which are watery, which are painless, which are not so maybe offensive, not so offensive. But the peculiar thing that I observed is, along with this loose motion, patient complains that after I have passed my stool, I feel very hungry. I feel so hungry, I feel that my whole abdomen has got completely empty. Like there's nothing remaining there. There's nothing remaining there and I just want to eat something now. Or at least drink something, and I feel very weak. I feel I will just faint, or I will just fall down, or I will just collapse out of my weakness. That is the peculiarity of the weakness in podophyllum, that they just prolapse, they just drop down out of after the stool. Suddenly they become weak and they just drop. It's not like, I am feeling weak. No. I'm weak, I just dropped down. And that intensity of weakness is initially seen in the stomach. I feel very weak and empty in my stomach, like it's gone completely empty. I need something to eat to fill it up again. And especially if you see this in summer. Two other important symptoms of podophyllum are, one is itching in the right hypochondriac region, itching in right hypochondriac region, and another symptom is loquacity during fever. Now, if you see patient is going on talking, irrelevant things, or in podophyllum what you will see is anxiety. You will see that the talk is about very similar to arsenic. Oh, I have this illness, maybe I am going to get a heart attack, maybe I am going to get cancer. And this arsenic generally thinks, and he mentions his once or twice, and he will take you to the doctor. But podophyllum will keep talking about it, telling it to everyone, constant, just going on. It is loquacity during fever or in delirium. Very important symptom of podophyllum. These are the two symptoms that I have seen in practice. One is loquacity and other is the emptiness in the abdomen, especially during summer. So now coming to the last remedy, that is cocculus. Cocculus is in some ways similar to colchicum. So in colchicum, we said that it has ailments from loss of vital fluids. Another important ailment of colchicum, where it is very similar to cocculus, is ailments from loss of sleep. But difference between cocculus and colchicum is, in cocculus the loss of sleep is part of overexertion. I'm overdoing things, I'm working, and that is an actual loss of sleep in colchicum. In cocculus, it is loss of sleep from taking care of others. While I am caring for others, while I am nursing others. So cocculus is very, very, very concerned about someone in family is ill. And because that someone in family is ill, first thing is they become very anxious and very tense. Oh, what will happen to this? What will happen to my mother? My mother has diagnosed of cancer. I have to stay with her. I will stay with her at the hospital every day. I will not sleep. I will just keep serving her. So I keep doing this for 1 month, 2 months. So I get weak and exhausted, drained. So there is over exertion or overt effort out of concern for the opposite person. My family member is ill. So out of the concern and anxiety, there are both the things. Very, very caring, very, very anxious. Both. Out of care and out of tension. Both I keep serving them. And then I become ill. And then I fall ill. Then I can't exert. Now there is no energy remaining in my body. I feel very weak, exhausted, tired. I can't do anything. I am so tired that I can't even stand. I can't even talk. I become so weak and drained out. Or it is known as bookworm remedy, where you are studying the whole night, sitting, studying, and along with the study you are also very anxious. Will I get marks? Will I pass? Will I get marks? So there is anxiety and overexertion and care and concern. My parents, they have put in so much of money, they have put in so much of this, so I have to do this for them. So there is, one is affection, care, along with that anxiety, will I pass the exam, and along with that overexertion. When you see all three things in together with loss of sleep, that is cocculus. Then patient starts to have loose motions, mucoid stools, painful. It is I have cured one case of ulcerative colitis on cocculus with similar kind of causative factors leading to ulcerative colitis, mucus, blood in stools, etc. Patient is very weak, anemic. Her HP was around 8 when we started treatment. Now it is around 12, 13. Now, another important feature that you find in cocculus is this kind of weakness also develops when they have menstrual complaints. And during the menses, one is they feel very weak, they are not able to stand, they are not able to talk, they feel very drained out because of the blood loss. But along with that, they will have pain or dysmenorrhea, but the pain, the location of the pain seems to be in the anus. Pain in anus, pain in rectum region, and they will faint. I have such intense pain in my anus that I fainted with my pain. Or I get vertigo because of my pain. Rectal pain with vertigo is a characteristic symptom of cocculus. When you have rectal pain or pain in anus along with vertigo, where patient is feeling I will faint, or patient can also faint. So these are some of the symptoms that I have seen in practice on cocculus, cocculus indicus. So those were the remedies I wanted to share with all of you. If you want me to share some more remedies, please write to me. I will be very happy to talk about those remedies. Before I end, I would like to give you one case and ask you to suggest remedies. So this is the case. Case is of a 35-40-year-old man. He basically is an athlete. He plays professional badminton. He used to play badminton in his younger days from the age of 13-14. Around the age of 18, once he got injured, his shoulder got injured, but he didn't want to rest. Doctors advised him rest and surgery, but he didn't want to rest because he felt if I rest, then I will not be able to take part in competitions. He was playing at the national levels in India. So he didn't want to miss that because he felt I have a very particular short time. In that time only I can play. So he ignored that and he kept playing. So the pain, he says, because of still constantly playing, the pain in my right shoulder is still there. The pain is such that it is very sharp shooting and it radiates down the arm. And nowadays it pains only in particular positions. But since the last 10 years I stopped playing, I started working in software and so the pains were not there. But nowadays, since the last 6 months, I have again started to play. So again I am playing at a very high level. So because it is very high level, it is lots of physical effort, lots of physical exertion. There's lots. I play continuously for 2 hours, 3 hours. So there's a lot of sweating, heat in my body, and I feel very tired. Now what happens nowadays? What has happened is, after I've played for 1 hour, 2 hours, and now I've finished playing, and I'm sitting. Slowly after 15-20 minutes, my body starts to cool down. As my body starts to cool down, I develop pain, very intense pain in my heels. Okay, this heel pain I think has started because I play and I bang my feet very often, so I feel some kind of injury has taken place in the heels also. So that is why this heel pain has begun. And along with this, I also have pain in my right back. This pain is a very sharp pain, sharp shooting pain, which shoots up, almost up till my knee joint from my heel. And also there is shooting pain from my back, which goes up. Very intense pain, intolerable pain. I have to take painkillers, and I am taking painkillers almost daily now. So can homeopathy help? That is why I have come. So now you tell me, what remedy should we give him?
Because the patient is having a lot of pain after playing and after exertion and after straining, so we can think of rest dogs. But the modality that when the body starts to cool down, the pain starts. So this is, I'm not sure of this modality, so it fits in rest dogs.
What else?
The pains, he said the sharp shooting pains. So there's no, in rest dogs there is a sore nest or yes, bruised pain.
So see, first thing is, generally what happens to us when we are seeing the case? First thing we think is, many of us will think that this is a case of injury. So we start thinking about remedies like arnica, Rostox, etc. Now, that is part number 1. What happens is then once we think of arnica, Rostox, ruta, we feel this is also musculoskeletal. So this is arnica, Rostox, ruta, something like that. Now what we have to realize that even though we are feeling that this is a injury remedy and this is something to do with musculoskeletal system, we have to observe that this patient type of pain, what is his type of pain?
Sharp shooting.
Shooting pains. What kind of tissue will give that kind of pain? So it is a nerve pain. Generally when you see shooting pains, radiating pains, or what you say, sharp pains, they are more pains to do with nervous system. Are you getting it?
Yes.
Secondly, you examine the part is not red inflamed, nor the part is blue. So it is not to do with blood circulation. So blood circulation, arnica, all those remedies are gone. Musculoskeletal, Rostox, ruta is gone because it is a nerve remedy. So first thing that we need to understand that I need a nerve remedy, even though this looks like an injury. Even if it is injury, it seems to be a nerve injury. So first remedy that comes to mind is hypericum. Okay. So then we think hypericum. But no, we have to then see how did this start. So then you see that the pains are because of over exertion, lot of effort, lot of effort to sustain a very high level of performance, right? I play national levels, I can't rest because if I rest then I will miss my competition. So I have to keep continuing. That is very important. That there is a constant ongoing effort at a very high level of effort. So when you see this, then you realize this is the issue of performance. Performance, exertion, all that, over exertion. So this is generally theme of metal remedies, performance, where you have to maintain your performance at such high levels of such high standards. Sportsmen are, who are sportsmen? Sportsmen are performers. They perform in front of everybody at high pressure situations, in high pressure situations. So there is pressure, there is performance. This is what you have to see. So there is high pressure performance leading to overexertion, injury and nerve affection. Then you see the modality, that it is aggravated by after he has got overheated. Okay. Then you observe that many metal remedies have ailments from after being overheated. Zincum met, ferrum met, cuprum, all metal remedies you will see after so much of physical exertion there is heat in the body and then they have complaint. Argentum nitricum. Again in argentums also you will see after so much of studying for so many days I have got so tired that tomorrow my exam is there and now I am not able to perform. Or tomorrow my competition is there. I have put in effort for 6 months preparing for the competition. I have ate this kind of food, I have ate that kind of food, I have maintained the most disciplined lifestyle. So now I am ready for the competition. But just when I am ready, my body is giving out. Just when the exam is there, my body is giving out. Because today is the performance day. But argentum nitricum we learned what affections it has. GIT. First is it also has nerve affections after overexertion, but along with nerves it has cartilage cartilage of what throat, that's why hoarseness, cartilages of joints, that's why joint pains. So specifically only nerves. The remedy that I gave this patient was zincumet. Okay, when you see overexertion with performance and need to be constantly on the go. This constant thing is very peculiar of zincumet. I can't rest. I have this much time only. I can't, what you say? Say no, now I will do the surgery. If I do the surgery, I will miss my opportunity to perform or to, I will miss my ambition. So they are ambitious people also. So you understand how you have to see the totality, not one thing or two things. Generally what is happening, why I particularly wanted to demonstrate this case is because what is happening is, you listen to all these symptoms and then you think that I will find this symptom, I will prescribe. You may not get results unless the totality is matching. You get involuntary stool and you prescribe aloe, it will not work. You just see the overheatedness in this case and you prescribe Rustox or Belispar or something, it will not work. Everything has to fit. The whole totality has to fit. You have to be very attentive. What are the various aspects that are coming up? That is how you find remedies. Don't jump so easily. Every single thing, don't miss any single thing also. And write it as it is, like patient said overexertion, patient said this. Ekdam simple writing. The more simple you keep, the exact words of the patient you write, you have the possibility of reaching remedies. Problem is, we jump to conclusions because we think I will not be able to find something. So we jump. जो समझ रहा है उसको पकड़ो, जो समझ रहा है उसको पकड़ो, ऐसा नहीं करना. समझ रहा है नहीं समझ रहा है बाद में का इशू. सारे पॉइंट्स ये है, सारे पॉइंट्स बैठने वाला रेमेडी चाहिए. Discuss, ask questions, discuss with people. You'll find remedies. You may not be able to find it today. You will take 2-3 days, 4 days, 1 week. But at least you will learn in at least next 1 year, 2 years, you will be able to prescribe remedies like this. But if you say no, I will prescribe Rustox, it is okay, or I will prescribe Hypericum also, not okay. सब बैठना चाहिए, A to Z, सब. ठीक है? So I end with this message with which I started. I may have given you lots of information regarding remedies, but the ultimate thing is to have that detective kind of approach to scan each and every particular thing that the patient is talking, taking each and everything that the patient is talking into your totality, and then deciding, once you have understood that, the whole picture, then deciding what is peculiar, strange and rare here. If you do that, you will succeed in homeopathy. So best of luck and see you also. Thank you.